As more and more vaccination sites open up across the country, more are ending up with leftover doses at the end of the day. So what happens to those extra shots? Well, the organization Dr. B is now working to match them to people willing to get vaccinated at a moment's notice. More than 500,000 people have already signed up, and we're lucky to have the founder of Dr. B, Cyrus Masumi, here to tell us more about it. Cyrus, thanks so much for joining us. First off, why the name Dr. B, and how exactly does the system work?
So the etymology of the name comes from my grandfather, who became a physician during the Spanish flu, the last global pandemic. And he dedicated his career to closing gaps between patients and care, which is exactly what Dr. B is trying to do. And so we thought it would be an appropriate hat tip to him. In terms of what we do and how it works, so Dr. B is a universal nationwide standby list for the COVID-19 vaccine. Any patient can go to hidrb.com and register. They fill out basic information that their government requires for their vaccine priority list. And any provider that wants to use it simply indicates if they have excess doses, how many doses they have, and what time they're expiring. And our system will do all the work to figure out exactly who to notify at the appropriate local government priority criteria, and effectively making sure that every single dose is claimed and spoken for, and optimizing to make sure that not only are they claimed and spoken for, but they're done so at the appropriate priority levels.
And how often does this happen? How often are vaccine providers ending up with extra doses at the end of the day?
It's quite frequent, and the reason being is that patients cancel or no-show on their vaccine appointments 20 to 30% of the time. Part of the reason for that is that the vaccine's in such short supply that people are booking multiple appointments at multiple providers and they're not canceling them. And that's resulting in a very complicated operational challenge for all these to add sort of additional operational challenges on top of what the vaccine providers need to do. And so we're really just trying to make a tool that at least simplifies one part of this whole process for them.
And I know you've taken several steps to ensure that the service will be equitable. Tell us about some of those efforts and why that's so important to you.
Sure. So earlier in this program, I was listening to discussions of vaccine hesitancy. As we know, and was indicated there, members of the Black, Brown, Native, Hispanic communities have had not just more negative impact from COVID, but they're also the same communities that we've seen a lot of vaccine hesitancy in. And the problem is that as these communities are more receptive to getting the vaccine, they're seeing their friends get the vaccine, and ultimately they become open to it. They then, a 1A or a 1B in some of the more vulnerable communities would then have to compete for an appointment with a 1D, 1E, or a 2 in sort of the rest of society, who can hit refresh 1,000 times a second and grab that open appointment. The benefits of a queuing-based model is that you can continually and in perpetuity prioritize the 1As over the 1Bs over the 1Cs, and you can do that forever. So someone who was previously vaccine hesitant that's in a high priority care category, as soon as they indicate that they want to get the vaccine, they immediately go to the front of the line. And so we think that it's a small way to help rectify some of the inequities and some of the hesitancy that's been systemic in this pandemic. And
so where is the service available, and how do you sign up?
So anyone, anywhere in the United States can sign up. We have rolled out with sites in Arkansas and New York State. We're trying to roll out to all 50 states as quickly as possible. We have providers coming to us. Over 30 states now have providers have come to us, and we literally are turning new states live every few days. So we encourage people to get signed up, to be on the platform, and we will notify you as soon as there's vaccines available.
All right, Cyrus Masumi with Dr. B. We are grateful to you. We're grateful to the original Dr. B, your grandfather, for all of his service, and so glad to see you following in his footsteps. Thanks for what you're doing.
Thank you very much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.